Hello, I'm Dr Manmohan Singh. I'm Vice Chairperson, Department of Neurosurgery, Paras Health, Gurugram. As you know that deep brain stimulation has become an integral part of functional neurosurgery, and over the years it is a standard of care for Parkinson disease and dystonias. Patients with Parkinson disease, they respond very well to drug therapy in the initial course of their disease. And as the disease progresses, their response to the drug therapy becomes less and less, and ultimately they start developing side effects to this therapy, and then no other drug is going to alleviate their symptoms. So then they become the candidates for deep brain stimulation, because this is the only therapy which is going to help them for their future response to the therapy. Same thing is true for the dystonias. Initially they are treated with the medicines, but most of the generalized dystonias, they do not respond to drugs, and they are the candidates for deep brain stimulation. Deep brain stimulation is not a cure for these either dystonia or with the Parkinson's disease, but it is a modulating therapy. And it, as the disease is progressing, but deep brain stimulation is going to alleviate their symptoms. It modulates their symptoms and it make their life easy. And over the long run, it is the only therapy which is going to help them. And all patients, either with Parkinson's or with the dystonias, they are the candidates for deep brain stimulation unless they have other long-term chronic condition. As the disease progresses, even in those cases, that the deep brain stimulation is helping them and it makes their life easy and their activity of daily living becomes better. That only few conditions, like where the patient is not a good candidate of deep brain stimulation, are where the patient has not responding to SYN-DOPA therapy in their early course in Parkinson disease, or Parkinson disease is a secondary effect of many other brain conditions where it is not a primary or the idiopathic Parkinson disease. In those cases, deep brain stimulation may not be a very good therapy, but even in those patients, it helps them partially. And same thing is true for dystonia. In dystonia, that idiopathic dystonia or the primary generalized dystonia, they respond very well to deep brain stimulation. But in case of secondary dystonias like encephalitis or other degenerative conditions which lead to the secondary dystonia, they may not be a good candidate for deep brain stimulation. But even in those cases, because the drugs are not helping them, deep brain stimulation will help them alleviate their symptoms and they make their life easy, and their activity of daily living becomes better. So I would recommend that say yes to DBS.
Say yes to DBS.